What could be more important than health?
We live in the richest nation in the history of nations. This is the greatest country on earth. And I refuse to believe that we cannot find a solution that allows every American to afford the medications that they need.
Hi, I'm Sarah.
I'm Lal.
And I'm Gabe.
And the issue you want the new Congress and President to address in 2021 is free universal healthcare.
We would like to explore our healthcare system and options like single payer, Medicare for All, and the Affordable Care Act and try to determine what would be best for the United States.
So, what is healthcare in the first place? According to international insurance, free healthcare means that citizens receive healthcare at no cost or at very minimal cost. Dr. Carbuto from Cal State Long Beach Student Health Services states what free healthcare is.
Free universal healthcare is, would there be a single payer, most likely the government being the single payer. It would cover preventive care, immunizations, care for acute and chronic problems, in-hospital problems, outpatient conditions, and probably long-term healthcare too.
Like Dr. Carbuto mentioned, we want the government to cover healthcare so that everyone has access to the treatment they need.
What about Medicare and Medicaid for all? You've probably heard presidential candidates or politicians talk about it to establish themselves, use it as a point of attack, or to gain popularity, but do people actually know what it means? According to Medicare.gov and MedicareInteractive.org, as an overarching generalization of the term, Medicare is a federal program that provides health coverage for citizens 65 or older, with certain younger people with severe disabilities. It is applicable to these populations no matter your income. This program will provide hospital insurance, medical insurance, and prescription drug coverage. Although the names sound the same, and they are both government-run programs, Medicare and Medicaid do not operate or target the same populations.
Yeah, again, unfortunately, it was not perfect.
The Affordable Care Act, also known as Obamacare, was a form of free health care for low-income individuals. However, it wasn't the best approach.
To give a lot of power to the insurance company, even though they asked the insurance to cover for pre-existing condition, but they let them set whatever premium they want to do and whatever coverage they want to do. So if you want a reasonable coverage, you have to have a deduction or a deductible amount. And a lot of people found it that is not really useful because they don't have this money anyway. So even though they have insurance, but still they cannot afford it. So it did not really help the problem with people affording insurance or even being kind of access to the doctor, because again, some patient cannot pay for the doctor visit because they have to pay this amount before their insurance kick in. So they don't go to the doctor.
So what are the pros and cons surrounding free healthcare?
The positive things, obviously, you get people covered so they don't go bankrupt if they have illness. People usually will get healthier because if they have access to primary care, they can get preventive care.
The con would be that it would mean probably increase in taxes. Some people may not have the choices that they're used to having. They may not get the care exactly when they want it. Some things may take a little bit more time elective surgeries and that kind of thing may take a little bit more time.
Looking at what Dr. Carbuto and Dr. Al-Sabeh said about free healthcare, it's apparent that the pros outweigh the cons.
Those who think free healthcare is too expensive or a form of socialism that is not compatible with our country.
That's nonsense. The same people who are saying that it's socialism, it's not compatible, love their Medicare, love their Social Security. Those are the exact same forms that a universal healthcare system is. They love what they have already. You ask those communities, will you give up your Social Security? They will say, absolutely not. I want to make sure when I retire, there's money for it. Will you give up if you have a disability or you're low income? Would you give up your Medicaid, which here in California is your Medi-Cal? They'd say, of course not. Or would you give up when you're 65 your Medicare, all your health insurance paid for by the government? They'd say, of course I will. There is no difference. All we're talking about is providing people the basic right of health care. It's no more socialist than Social Security, Medicare. That's not really a problem.
One of the many issues with the pandemic is that it has exposed the flaws in our healthcare system. When people's insurance and coverage are tied to their jobs and the pandemic results in millions of layoffs, we are left with a tragic situation where people are unable to work and unable to get care due to the fact that they are unemployed and therefore uninsured. As we have seen from all of the interviews, it is apparent that free healthcare should be a right for everyone, regardless of your income, social status, and ethnicity, whether you're young or old, disabled or healthy. You deserve and should have the right to free healthcare.
As Martin Luther King Jr. said, of all the forms of inequality, injustice in healthcare is the most shocking and inhuman.